my name is Kellyville, and this is my wonderful husband, Michael, and he's volunteered to be my patient for today. Before we came in here, I had checked his vitals, I checked his height and weight, and I also had him do the Snellen chart to check his vision. I had him dressed down to just his shorts so that we can do a proper assessment on him. So, Michael, we're going to start with your head. It's upright and still with no tics. It's rounded and normal cephalic with symmetry and no lesions or masses. Your eyes and ears are symmetrical, and your skull is mobile, non-tender, and free of nits or sealing. Your skull has no depressions, masses. It's symmetric and smooth. Your hair is symmetrically distributed with no signs of alopecia. You do have a little bit of baldness, which is common for men. We're going to palpate your facial bones, and those have no masses or tendernesses. Your sinuses, your maxillary sinuses and your facial sinuses have no swelling or tenderness, no masses either. We're going to have you open your jaw for me and close and move your jaw from side to side. And I'm not noting any clicking, so that's good. Next, we're going to assess your cranial nerves. I'll be assessing your face for symmetry, okay? So I'm going to have you wrinkle your forehead, shut your eyes, squeeze them as tight as you can. I'm going to have you clench your teeth. Just clench your teeth. Smile. You can unsqueeze your eyes. Puff out your cheeks. Stick your tongue out. And that's all good. So that means your cranial nerve 7, which is your facial nerve, is intact. Next, I'm going to check cranial nerve 5, which is your trigeminal nerve. And that one, we're going to check for sensory and motor function. So I'm going to touch you once your eyes are closed, and you're going to tell me where you're feeling it.
Forehead, cheek, chin.
All right, that's great. So that means that your cranial nerve 5 is intact. Your eyes, they're symmetrical. Your eyebrows are equally distributed, and they extend toward the outer canthus. Your orbital and periorbital areas are free of swelling and redness. Your upper eyelids cover a portion of your irises bilaterally, negative for ptosis. I'm going to have you close your eyes completely, and they're negative for tremors, tenderness or flakiness, no nodules or tenderness noted on palpation. Your eyelashes are present on both eyelids. Open your eyes for me. Your irises are blue bilaterally, and your pupils are equal and round. Your sclera is nice and white, and your conjunctiva are pink, just like they're supposed to be. I'm going to palpate your lacrimal apparatus, and I'm not noting any exudate or excessive tearing. Next, I'm going to test your peripheral vision. So I'm going to come from back here, and you're going to tell me when you see my hands.
Yep.
Okay. We're going to check you for confrontation. Watch my finger. All right, good. And then I'm going to have you cover one eye, and I'm going to have you watch my finger and come out. Cover the other eye. Watch my finger and come out. Pupils respond equally. Now I'm going to have you watch my finger on this side, and we're going to make sure that this pupil reacts also. All right, and then on this side. All right, perfect. Your extraocular movements are great. Now we're going to check your cranial nerves 3, 4, and 6 for, we're going to look through the 6 cardinal fields of gaze. So I'm going to have you follow my finger from the middle, up to your left, down to the middle, to your right, and up, back to the middle. All right, perfect. So cranial nerves 3, 4, and 6 are intact with that. We're next going to check your red reflex, okay? So I'm going to use my ophthalmoscope. All right, I'm going to start at 0. So I'm going to check your eyes here. And your red eye reflex is intact on the right eye. And we're going to check the left eye. And it's also intact on the right eye. And put that down. Now we're going to use Rosenbaum's test. So I'm going to stand at a distance. I've got one right here printed out for you. If you can read this is my Rosenbaum test. If you can read the lowest line that you can.
LEFODPCT.
Perfect. So that's 20/20 vision that you have. Now I'm going to check your ears, your alignment, your auricles line up, and they line up with your outer canvas. They're symmetrical on both sides of your head, and they're the same color as your facial skin, with no deformities or discharge noted. I'm going to palpate them. They're firm, mobile, and non-tender. I'm going to use an otoscope now to check the inside of your ears. We want to make sure that your ear canals are pink, with no drainage noted. So I'm going to turn this on. We're going to check your ears. Perfect. Your ear canals are nice and pink. A little bit of cerumen noted. And your tympanic membrane is nice pearly gray, which is exactly what it's supposed to look like. And your right ear is exactly the same. Perfect. So we'll put this down for now. Now we're going to do the whisper test. So I'm going to have you cover one side of your ear, and I'm going to whisper something in your ear, and you're going to repeat it back to me.
Flower. Roses.
Perfect. Now we're going to do the Weber test, and with that, I'm going to smack these tongues, put them on top of your head, and you're going to tell me if you hear the sound the same in both ears.
Yep.
All right. Now we're going to do the Rhine test. And with this, we're checking air conduction versus bone conduction, and air conduction should be greater than bone conduction, okay? So you're going to tell me when you stop hearing the sound.
Okay. Okay.
All right, and we're going to do the same on your right ear.
Okay. Okay.
And that means your cranial nerve 8, which is your acoustic nerve, is intact. So that's great news. Now we're going to check your nose. It's midline and symmetrical. Your septum is also midline. Your nares are both patent from the outside. We'll check inside here in a little bit. They're oval and symmetrical with no flaring noted. The skin is smooth. I'm going to use my otoscope here again, and we're going to check inside your nose, make sure they really are patent. And it looks good. And that side looks good too. So your turbinates are the same color as the surrounding tissue with no swelling. And like I said, that septum is midline with no perforation or bleeding noted. Okay? As far as your mouth goes, your lips are pink and smooth with no lesions or cracks noted. Can you open your mouth a bit for me? We're going to use this tongue depressor, and I'm going to check. Your buccal mucosa is smooth with no lesions noted, no masses either. Your tongue, stick it out for me, is nice and pink, a little bit rough, and that's all normal. It's symmetrical too. Lift up your tongue. Your ventral tongue is smoother and pink, and it has a frenulum present. Your teeth, you have 32 white teeth. They do show some wear. They look good. Otherwise, your gums are tight. They have tight margins to your teeth, and that's good also. Can you tilt your head back and open your mouth for me? I'm going to use my light here. So your hard palate is intact and looks good, and your soft palate extends from your hard palate, and that actually looks really good too. Your uvula is midline, your tonsils are removed, and the side pillars look great. Okay. Your posterior, open your mouth for me again. Your posterior pharynx is smooth and has a little bit of glistening, and that looks good. Next, we're going to test your cranial nerve 10, which is your vagal nerve, and that stimulates your cranial nerve 9 also when they're tested together. So we're going to test your gag reflex is what that is. I'm going to have you open and say ah. Ah. Cranial nerve 12 is your hypoglossal nerve, so that tests the strength of your tongue. With that, I'm going to have you stick your tongue out of your mouth for me. It's midline and there's no tremors noted. I'm going to have you put your tongue in your cheek and the other side and do it again. All right, and it feels good. I'm going to have you stick your tongue out again, put it towards your chin and up towards your eyes. Perfect. Hypoglossal nerve is intact. Now I'm going to inspect your neck. So that's symmetrical and midline with no swelling noted. Your skin is smooth and intact. There's no obvious jugular venous distension or prominence of the carotid arteries. The range of motion we're going to do some passive and we're going to do some active range of motion. For passive, we're going to have you put your head forward and I'm going to bring it up. I'm going to have you tilt your head to the left and tilt it to the right. And then I'm going to have you tilt your head back. Perfect. Now for active range of motion, we're going to have you shrug your shoulders and then turn your head left and right. Perfect. And that should be smooth with no tenderness or pain noted when you're doing that. Is that correct? Correct. Awesome. So we're going to now palpate your carotid pulses one at a time. And they're strong and regular. Your tracheal position is midline. Your thyroid is smooth. Now we're going to palpate your lymph nodes, and I shouldn't be able to palpate them, but we'll go to the locations that they're at. So, for your occipital, your pre-auricular, and your post-auricular, your submandibular, your submental, your superficial anterior cervical chain, and your posterior cervical deep. We're going to check your cervical. I'm going to have you turn your head towards the side and to the other side. And we're going to check your supraclavicular and your axillary. Perfect. And I wasn't able to palpate any of your lymph nodes. Now we're going to listen to your neck. I'm going to listen to your carotid arteries with the bell of my scope, and I shouldn't hear any bruising. And then I'm going to also listen to your thyroid on both sides, and I shouldn't be able to hear bruit with that either. With your carotids, I'm going to have you take a deep breath for me and hold it, okay? All right, nice deep breath. Sounds good. And the other side. Take another deep breath. Perfect. And breathe normally. I'm going to listen to your thyroid. Perfect. All right, as far as your upper extremities go, they're equal in size and musculature on both sides. The hair distribution is also good. The skin is warm and dry and intact with no lesions or edema noted. Your nails, we're going to check, and they're uniformly clean and pink. Your nail beds are firm, and your cap refill is less than 3 seconds. All right. I'm going to assess your radial pulse here. And that's strong and regular. And your brachial pulse. And that is also strong and regular. Okay. Now I'm going to have you turn around. I'm going to check your back. The skin is smooth, dry, and intact. It's symmetrical with no skeletal deformities. Your cervical and your lumbar areas are convex, while your thoracic area is concave. Your thoracic configuration AP diameter is less than your lateral. Okay, so that's turn around this way, making sure that this front part, if you lift your arm up, is less than the back part. Okay, All right, so now I'm going to palpate and percuss your back. Turn around again for me, please. So we're going to feel around your organ structures. And there should be no tenderness noted when I'm doing this. And then we're going to percuss. All right. We're going to inspect the area where your lungs is on your back, and that should be symmetrical. Your chest rise and fall is equal and symmetrical. Your respirations are even. Take a deep breath. And unlabored. Your thoracic expansion at the level of your 10th rib is equal expansion. Take a deep breath for me. And now we're going to check for tactile parameters. So I'm going to have you say 99, okay? And we're going to palpate. Go ahead.
99, 99, 99, 99, 99.
Perfect. All right. Now we're going to percuss for resonant sounds on the posterior side of your chest. So I'm going to have you lean forward and shrug. All right. And now your lateral side of your chest. I'm going to have you lift your arms up for me. All right. Then we're going to do your turn around again for me, your diaphragmatic exertion. So I'm going to have you take a deep breath in and hold it, and I'm going to check your resonance to dullness and then mark it, okay? So lift your arms up for me. Put them down, sorry. Take a deep breath in for me, okay? Hold it. All right. And let your air out as far as you can. All right, so I'm getting about here and here, and that's about 3 to 5 centimeters, which is a normal finding. I'm going to take a listen to your lungs on the back, and I should have clear vesicular sounds with no abnormalities noted, okay? Nice deep breaths for me. All right, perfect. Now I'm going to have you turn around and we're going to do the front side of your chest. So as I inspect it, I note that the skin is smooth, dry, and clear of any lesions. There's no pulsations or heaves. Your chest rises symmetrically as you take breaths in, rises and falls equally, okay? Your effort is unlabored and your respirations are within normal limits. We're going to percuss this front side for resonant sounds. And then we're also going to listen to the lungs on the front, okay? All right, and I'm going to take a listen now. Nice deep breaths for me. All right, as far as your heart goes, we're going to inspect it. There's no pulsations or heaves noted. We're going to palpate the anterior chest wall. Your precordium is negative for any thrills. And there's no evidence of any heaves or lift or thrills, okay? Now we're going to also take your heart valves, and those are your aortic, your pulmonic, your tricuspid, and your mitral valves. You can remember those as all physicians take money. And so we'll go ahead and listen to those. We want to make sure we're not hearing any murmurs or thrills, okay? So the aortic, the pulmonic, the tricuspid, and the mitral. And I'm not hearing any murmurs or anything, so that's good. So now we're going to move to your abdomen. As I inspect it, we look across it, and we note that the contour, your abdomen is rounded with symmetrical contour. There's no visible pulsations or peristalsis. Your skin is uniform. There's no distension. Your umbilicus is inverted and midline. There's no bulges present. I'm going to have you raise your head slightly. And your muscle prominence has no separation. We're going to listen to your belly. And there should be active bowel sounds in each quadrant. We're going to auscultate your arteries in your abdomen by using the bell of my skull. So your aortic, your renal arteries, your iliac, and your femoral. Now we're going to percuss each of your organs, make sure that there's no tympani or resonance or dullness, okay? So your liver, your kidneys, your spleen, and your other kidney. All right, so that all sounds good. Now we're going to palpate your abdomen. There's no abdominal muscle tenderness, and if we go deeper, your right costal margin for your liver, take a deep breath in for me. And as you take a deep breath in, your liver should be displaced down, and that's good. And on your left side, if you take a deep breath in, we shouldn't be able to palpate your spleen, otherwise it's a sign that it's enlarged, okay? So that's all good. Your kidneys on the left and right. And aortic pulsation we'll check. And that's good too. All right, now we're going to move on to your lower extremities. And with those, we're going to say that they're equal in size and length. The hair is distributed equally. The skin is the same color as the rest of your body. The skin's warm, dry, and intact with no edema, color change, or pain noted, okay? Your nail characteristics on your feet are pink and firm. Your nail beds are very firm. And also your cap refill is less than 3 seconds on your toes too. All right. Now we're going to check your popliteal pulses, which are behind your knees. Your posterior tibial, which is kind of on the inside of your ankles, and then your dorsalis pubis, okay? So we'll check those pulses. And those have a regular rate and are very strong. The rhythm feels regular also. All right. Now, Michael, you're awake and alert, obviously. Can you tell me your name?
Michael.
Do you know where you are?
My house.
Can you tell me your date of birth?
July 26, 1989.
Do you know what today's date is?
April 23rd, 2017.
Perfect. For your fine motor, we're going to check. I want you to touch each of your fingers to your thumbs. And go backwards. And then I'm going to have you switch from your palm of your hands to the top of your hands. And just switch. I'm going to have you put your your heel against your shin and write it down and back up. And then the same on the other side. Perfect. And lastly, I'm going to check your reflexes. So we'll use my reflex hammer that I have right here. And we'll check for that. So we're going to check your biceps right over here for a reflex, and we're going to make sure that you have a reflex. All right, and the other side. And then we'll check your triceps. All right, and the other side. And then we're going to check your patellar reflex. So that's down here in your knee. Dangle your leg dependent. All right, and the other side. Perfect. And that concludes my assessment of my husband, Michael Bell. I hope you enjoyed it and learned a lot. Thank you so much.